Hi everyone! I'm going to begin by discussing how the Shape-O toy made by Tupperware can be used in therapy. It's a really versatile toy because it can be used as a rattle, a shape sorter, and a counter. It comes with a ball that has handles on both sides, making it very easy for a child to be able to pull the ball apart in order to get the shapes out. It comes with 10 different shapes, and these are all sized with the child's safety in mind. So this toy is very safe, although it's always important that therapists and parents monitor their children when they're using this toy. Each shape comes with dots on one side that correspond with a number on the opposite side. So not only can this toy be used for shape recognition, but it can also help children learn how to count and recognize numbers. Because of its versatility, the Shape-O toy can be used anywhere from 6 months all the way to 5 years. There aren't any gender associations with the toy, so males and females alike will enjoy using the toy in therapy. Also, there aren't any cultural associations. However, it has been around since about the 1960s, and Tupperware is in 100 different countries. So it's very likely that the Shape-O toy is a really familiar toy to many different cultures. Again, because it's a versatile toy, the skills that are needed in order to complete the toy can vary depending on what the therapist asks the child to do. So as I begin to talk about the fine and gross motor skills, the perceptual skills, and the cognitive skills required, I'm going to be talking about what skills are required to use the toy as a shape sorter. There are both gross and fine motor skills that are needed to complete this activity. The gross motor skills include the child must be able to maintain a dynamic seated balance. However, this can be completed at the standing position as well. For fine motor skills, the child must be able to accurately reach for items. They must be able to pick up items, perform in-hand manipulation, and grasp items with their fingertips. Once they have the item in their fingertips, they must be able to perform a controlled release. Bilateral integration is also very important, and this is going to allow the child to be able to use both hands to open the toy in order to get the objects out of the middle. The Shape-O toy requires a lot of cognitive skills. A child must be able to motor plan, sequence events, and utilize their procedural memory. They also must be able to maintain their attention span and form their own thoughts and ideas. They have to be able to follow the therapist's instructions and utilize spatial operations and pattern recognition. And this spatial operations allows them to mentally manipulate the objects in order to fit them appropriately into each shape. There are many perceptual requirements for the Shape-O toy. It requires a child to incorporate spatial relations, which is the ability to accurately judge distances, depth perception, figure ground perception, and visual motor integration. It also requires the child to incorporate shape constancy, and this is the ability for the child to recognize that although this triangle might be oriented differently than the triangle on here, they're both in fact triangles. It also requires the child to visually track items. So the child must be able to track their hand in order to pick up the shape, as well as track the shape until they place it into the appropriate spot. Depending on what age group and how the therapist decides to use the Shape-O toy, it can either fall under Piaget's sensory motor or pre-operational stage. And as far as part stages of play, it's going to typically fall under the solitary play. However, if the therapist decides to utilize several different children to take turns putting shapes into the circle, it can fall under cooperative play. There are social, emotional, and psychological aspects to consider when administering this toy in therapy. It's important for therapists to realize that this can be a source of frustration for children if they lack the skills that are necessary to be successful with the toy. So in order to combat these feelings of frustration, a therapist can adapt the toy. And one way to do this is to cover up a lot of the more difficult shapes and then to only leave a couple shapes out on the table. That way the child is able to focus just on a few shapes at a time, and this can really eliminate the frustration the child feels. So overall, I think this is an excellent toy to use in therapy. It's a great way to work on gross and fine motor skills, cognitive and perceptual skills, and most importantly, it's a great fun and challenging activity for children.